So Johnson & Johnson announced that they have completed enrollment for their trial for their one-dose vaccine candidate. They actually ended up lowering the target number of participants in the study. Um, what drove that decision, and does it have any implications, Brian?
Yeah, so they were planning for 60,000 patients, and then they lowered it to 45,000 patients. So this is an events-driven clinical trial. So most clinical trials are time-driven. So if you think of something like psoriasis or rheumatoid arthritis, you treat for a certain amount of time, and then at the end of that time, you see whether the symptoms improved. Events-driven trials are measuring a certain event. So in the case of a vaccine, that's infections. Cancer trials are also usually run as event-driven clinical trials, and then you're looking at survival or progression of the disease. You run the trial, you count the number of events, and the trial's blinded, so you don't know whether those are occurring in the placebo group or in the treatment group. And then after you get to a certain number of events, then you unblind it and look and see where did those people get treatment or did they get vaccines? So if the infection rate is higher, which it is, than when they first started the clinical trial, then the trials can be smaller because the number of events will happen sooner. If it's a very rare event, then you need more patients than if it's a more likely event. And then also, if the efficacy is higher, then the trials can be smaller. So if you were looking at 200 events and it was going to be, 90 and 110, you don't know whether that's necessarily a difference, but because the other vaccines were so good, they may have also decided that they feel like they're more likely to get a bigger separation. It's going to be 190 and 10, and so out of 200. So then the breakdown's pretty obvious if the vaccine is working.
Definitely. So when should we look for data from Johnson & Johnson's phase 3 trial? And do you have any kind of estimates for timeline on regulatory submission?
Yeah, so the interim data, Johnson & Johnson has said they expect the data by the end of January, but again, it's event driven. So it's going to depend on when people actually get infected, and whether they get infected in the placebo group or the vaccine group. If that happens, and they're planning on submitting the emergency use authorization to the FDA in February, and they'll do other countries in parallel. I think they probably need some more additional safety data, so that's why they can't quite do it at the end of January. And then they take a few weeks for the FDA to review it. So maybe they didn't say when in February they'd be ready. So it could be as early as they could get approved or authorized as early as late February, and maybe as late as the second half of March.
Definitely. So one thing investors should know is that Johnson & Johnson has pledged not to profit on this vaccine during the pandemic. So how does that factor into any sort of investment decision into Johnson & Johnson?
It goes back to that same immunity question. We just don't know how long the vaccine is going to last. And so if it's a one and done and that gets rid of, enough people there's enough herd immunity that the virus goes away, then obviously they're not going to benefit at all. If it requires that we get a booster every year, 4 years, or 5 years, or 10 years, then they'll obviously benefit a little bit. That Johnson & Johnson is huge, so and well diversified. So it doesn't mean that I wouldn't invest for the coronavirus, but it doesn't mean you shouldn't invest in Johnson & Johnson if you're looking for a solid, diversified healthcare investment with a solid dividend that just keeps going up.